I'd like to now call on John McDermott, Director, CGIAR Research Program on Agriculture for Nutrition and Health at IFPRI. John will talk about health shocks, dealing with food safety, nutrition, and public health crises.
Right. So when we started off, we tried to paint the picture of the relationship and the intimate relationships between health shocks writ large and resilience. And it's hard not to imagine anything more disruptive than epidemic disease, for example, in terms of problems. But we also highlighted in the kind of household resilience, the kind of resilience to single shocks, but where often households fall into poverty because of multiple shocks. And these shocks tend to often be health shocks. Overwhelmingly, they're health shocks, and that people can't recover from them. So that was important. And I think the other aspect in this bi-directional relationship was that even relatively small kind of economic shocks or climate shocks or whatever often had an effect, particularly on nutrition and nutrition of children. So, you know, kind of looking at a resilience framework and bringing health into that, we felt was very valuable. Now, related to some of the discussion this morning, obviously prevention's preferable, but we're not always that smart. And often things come about. So we need some capacity to adapt and respond. We felt that one of the challenges moving forward was that there's such dynamic change in terms of intensification, in terms of population, in terms of urbanization, that sometimes there was real challenges in responding, and that we needed different types of response to deal with that. So what are some of the response mechanisms that people thought about? Well, one was that context matters, and many of the things you heard about in terms of empowering local response to health shocks was going to be quite important. The second one was that because of the intimate nature between the kind of health and nutrition of people and human capability, that we saw human capability as one of the key levers for moving forward. And this is human capability both at individual level, but also at group level. And that would need, you know, in addition to the kind of health expertise that was required, it will require kind of enabling and empowerment of groups, and that was all important as a kind of central lever, you know, when we're talking about multiple sectors, multiple partners, etc. Human capability could be one of those key levers, and I think we saw some of the decision makers and policy makers actually stressing that. But we're always expecting that there will be stressors in this dynamic change that will overwhelm capacity of individuals, of small groups. And there we felt it was really important beyond the regular practices to have common support, whether it was insurance, whether it was public provision, whether it was equity targeting to help specific people, to really come to grips with some of the health and nutrition shocks moving forward.
Thanks, John.